All right, first I want to say thank you. We have Dr. Tina Stefanski here to speak today. She's also joined by Ms. Dodie Lamont, who's the CEO of Southwest Louisiana Primary Healthcare. And they're going to be talking about an initiative that's going to be coming up this week, an opportunity for testing on the north side of town. So good news there. More good news, in the spirit of giving, Chick-fil-A franchise owner and operator John Arton is donating 3,000 meals to lighten the burden many families are experiencing during this pandemic. So the meals are for people in the community who are unemployed, who are working fewer hours, who are struggling right now, maybe because their kids can't go to school and they have to stay home from work. So for 3 consecutive Saturdays, starting this Saturday, LCG will distribute 1,000 chicken sandwiches, fries, and a cookie at Graham Brown Memorial Park at 1234 Pont de Mouton Road, and that'll begin at 11 a.m. So again, first distribution is May 2nd, second distribution is May 9th, and third is May 16th. Again, that's at Brown Park, starting at 11 a.m. I want to remind everyone, Robichaux Recreation Center is continuing to hand out meals on weekdays, starting at about 10:45. So line gets pretty backed up. You want to get there early. That's at Robichaux Rec Center on Erass Landry Road, thanks to Drew Breeze and the Breeze Dream Foundation and walk-ons. And a reminder about 311 option 1, that's the medical screening hotline. You can call, speak to a medical professional that is staffed 24 hours a day. If you are feeling like you may have symptoms or you may have come in contact with someone who has symptoms, give them a call. They'll pre-screen you and tell you where to go next, whether that be urgent care, the emergency room, or just your physician. Option 2, weekdays from 10 a.m. to 2 p.m. You can call. It's the LEADA call center. Get info about SBA loans, Paycheck Protection Program, unemployment. They'll also give you information about masks. If you're still in need of masks for your employees, call 311 option 2 between 10 a.m. and 2 p.m. Give them your name, the amount of masks that you'll need, and your business. The person has to be the name given. The next day you come by here at LCG at our drive-through, 705 West University, and you can pick up those masks. And also, there are still jobs available for folks who are unemployed and looking for a job. Go to lafayette.org/COVID, and you can see the job listings there. With that, I'll hand it over to Mayor President Josh Giller.
Thank you, Jamie, and thank you to Ms. Dodie Lamont for joining us, and thank you, Dr. Stefanski, Chief of Police, Chief of Fire. Thank you, guys. Appreciate you, and thank you for joining us and being with us here today. We have 446 confirmed cases of COVID-19 since March 18th on a base of 8,458 tests. Today we've recorded 3 new fatalities for a total of 21. Yesterday afternoon, Governor Edwards announced that his stay-at-home order will remain in effect until May 15th. A lot of people are disappointed, frustrated, even angry. I can certainly relate to those feelings. I want this all to be over as much as anyone. I want to get past the public health emergency to focus full-time on our economic emergency. I want to be able to focus on all the issues we discussed during the election. I want to unite our parish for a safer, more prosperous future for all of us. However, it is clear that the governor is closely following the federal guidelines laid down by President Trump, Vice President Pence, and the National Coronavirus Task Force. The governor spoke with the vice president prior to making his announcement yesterday, and they were in total agreement. The simple fact is, Louisiana and several of its regions, including Acadiana, do not yet meet the federal criteria for Phase 1 reopening. I think it's helpful if we review the timeline. Louisiana recorded our first case on March 9th. The first case wasn't recorded here in Lafayette Parish until March 18th, 9 days later. That was the day we began mobile testing at the Cajun Dome. In our rural parishes surrounding us, the first cases were not yet recorded until 4 or 5 days, even a week later. So our infection cycle began later than in the greater New Orleans region. While they had contagion hotspots, overwhelming of the healthcare system, and a spike in mortality, we got ahead of the infection, had more limited spread, ramped up testing faster, had less impact on our healthcare, and lower mortality. This is a good thing. and something we should all be proud of. It does mean, however, that our flattening of the curve stretched things out a little longer. This is exactly what we expected to happen when we first talked about it roughly six weeks ago. As we forecasted back then, we have successfully avoided the highest or the harshest impacts of the virus so far here in our parish, while somewhat extending the time frame. While infections, hospital admissions, and fatalities in the New Orleans area are now dropping, other regions of the state are still earlier in their cycle. We never had quite the massive spike in confirmed cases and are still working through our infection curve. Again, this is what we expected, and this is what we worked for. We have done well here in Lafayette Parish. We had an 8-day stretch without a single new recorded fatality. Our new confirmed cases, including today, have slowed to a trickle. Our healthcare first responders and stakeholders have been nothing short of amazing. Our community has made a real effort to act responsibly. Across our region, we're still seeing new fatalities and cases. Acadiana as a whole has recorded a doubling of fatalities since Easter. In some cases, we're not doing quite as well as we need to with social distancing and other measures. Overall, however, we're earlier in our cycle and still working to ramp up testing in our more rural parishes and communities in the region. I appreciate the hard work of our mayors and parish presidents across Acadiana. It is an honor and a privilege to serve with each and every one of these dedicated men and women. I know that everyone is working diligently to do what is necessary to keep our people safe and get through this public health emergency. It is critical that we continue to work hard, exercise diligence and vigilance, so that all of Acadiana will be ready for Phase 1 reopening in just 2 weeks. Here in Louisiana, we are fortunate that our stay-at-home order makes allowances for the things we need to do in our day-to-day lives. We get groceries, go to the pharmacy, and do our banking. Here in Lafayette Parish, 85% of our businesses are able to go to work and open up. We even go to the home improvement stores to buy supplies for projects we are working on. In fact, we've had complaints that too many people are out and about and that we're not taking it seriously enough. There are several states in which you can be arrested for leaving your home. We haven't had anywhere near that level of restriction here in Louisiana, Acadiana, or Lafayette Parish. Starting Friday, there are 3 new elements expected to be part of the governor's updated orders. According to the governor, restaurants will continue to offer curbside and takeout service. If those establishments have outside tables, customers can sit and enjoy their meals there. The restaurants may not provide table service, however. Again, according to the governor, all employees of businesses who have contact with the public must wear masks. While malls remain closed, stores may commence curbside service for their customers. To me, one of the toughest elements of this whole public health emergency has been social distancing. As a culture, we like being close to each other. The idea that you can't hug and kiss mama, it cuts at everything that we feel and that we believe. Keeping grandchildren away from their grandparents, it almost feels like a sin, even though we're just trying to keep them safe. Our ongoing challenge is to fully embrace the idea that this is exactly what we need to do to keep our loved ones safe. This is precisely how we protect those who are most vulnerable among us, the elderly, and those with hypertension, heart disease, diabetes, and other serious underlying health conditions. On Friday, the governor will publish his updated emergency declarations for the state. I will work closely with our public health advisory team, our local business community, and our regional leaders to make sure we get the maximum benefit possible out of the next 2 weeks. We will implement local directives to comply while tailoring our response to our local situation. We will continue to ensure our businesses understand what is expected of them and that our citizens have the information and resources that they need. As always, I'm committed to keeping our parish healthy and safe. I'm committed to putting our people back to work safely. and getting our businesses up and running. And I am truly honored and humbled to serve as Lafayette Mayor President. Let's take a moment to pray for all of those who have lost their lives to this very deadly virus, both in our parish and across our nation around the world. Please join me. Thank you. I do have time for questions. We also have, again, Dr. Stefanski and Ms. Lamont is here as well to talk about testing, and Carlos is here as well. So any questions that you have of me, I'd love to take them.
I know that you said one of the areas that you were looking on tackling next was capacity. I know the governor said that, 10 people or less inside stores. Does that sort of change the direction you're hoping to go next?
Yeah, no, and thank you, Neil. I appreciate the question. No, it doesn't change our thought process. I believe, personally, if it were up to me, that would be the next part that we would look at into our Safe Shop guidelines. Again, this is uncharted waters for our president, for our governor here locally, and we're all trying to just figure it out. I believe the governor's acting in good faith. While I would have loved to have had more local decision-making authority, autonomy here in the parish or even as a region, I can understand where the governor's coming from. The governor's looking at this situation as a state, and he has individual regions. And as a region, I can understand him looking at those numbers and saying this is the direction we're going to go. But as far as the call of your question, I think it's the most appropriate thing to look at next is capacity. Yes, sir.
Are there any planned changes to the Safe Shop guidelines to conform to the governor's expected updated order?
No, Andrew, we're still in compliance, and we're going to continue to exercise in the guidelines under Safe Shop that we had. There's no need right now. Getting the news from the governors yesterday and getting updates from our health team here locally. We believe the guidelines are right where they need to be right now. But again, it's an ongoing, changing situation. We take with every day comes new data, and when we get the new data, we adjust and overcome any obstacles that are thrown at us. Yes, sir.
So you said looking to tailor our response to the local situation. Can you give us an idea of what that looks like? Where do you see room to do that within the governor's order?
Yeah, I think Safe Shop is probably the clearest example where we take the governor's statewide emergency declarations and we work with our legal team, work in compliance with his legal team to make sure that where there is discretion that we make a responsible decision, but we make sure that we maintain compliance with the governor's orders. So Safe Shop's probably the clearest example, and if there's some other areas, we'll definitely explore those. Again, uncharted waters, and if there, I was sometimes I laugh about it, but we have manuals for everything. We have look, I'm telling you, go to my office right now. You have a hurricane comes, we got a manual for a hurricane. Because we've always experienced something, some kind of natural disaster that we can at least resort to and rely on. I looked in my office, there is no manual for world pandemic. So, and I bet you if the governor looks hard, there's not one in his office either. There's probably not one for the president as well. Maybe for the president, but not for us.
Were you surprised yesterday to hear Acadiana was one of the regions that was kind of holding us back, holding the state back because we're not complying as well?
Initially, yes, but as we looked at it and we kind of look at the data, and we talked about it here earlier, when this deadly virus came to our state, and I know Dr. Stefanski can talk on it better than I can, we saw a very large spike in the Orleans area and even in the Caddo Parish area. Then we didn't get our case till a little bit later, 9 days later. So we had the benefit of looking at this data here in Lafayette. We had the benefit of looking at our nation and the world. So we talked about this 6 weeks, right in that parking lot 6 weeks ago, how we want to flatten the curve. Well, we've done that, but flattening the curve here means that we're going to stretch things out a little longer. Other areas in our region, to directly answer your question, they got their cases sometimes a week after Lafayette, so their curve is a little longer than ours too. So you had New Orleans, real high spike. Then you had Lafayette, then you had our region. So another thing to note though, Claire, is, and I'm very, very happy that we had updated statistics in our testing. As we learned over the weekend, over half of the tests that were administered in Lafayette were tests for members outside our parish, which just goes to show you how Lafayette serves as a hub, not only in commerce and people come here, and we'd love for you to come shopping here in Lafayette and visiting, but also as a healthcare hub. I mean, just a kudos to our members at Lafayette General, Our Lady of Lourdes, LHC, all of our healthcare providers, our warriors out there on the front line. When you think back at the Cajun Dome, our medical doctors, they were there. They were in the front line volunteering their time. Many of their staff volunteered their time. But these were the men and women that took this fight to literally to the front lines here in Lafayette, and as we know with the updated statistics, to the front lines of our region. So I wasn't, as I looked at it some more, I wasn't as alarmed by it.
3 new deaths reported today. You think that's relating to Easter Sunday or just?
It could be. Again, I'll defer to Dr. Stefanski to answer. I don't know if you can answer that with certainty. I don't know if you heard the question or not, but it probably wouldn't be unreasonable to come to that conclusion. It's right around that time frame, right in that incubation period.
So,
You had a Facebook question?
Where do courthouses fall in as far as opening up normal operations?
Great. So courthouses were still they're public buildings. Okay, so they are closed as of right now. We should have some guidance, and we're working with Chief Judge Marilyn Castle here in Lafayette Parish. And again, I can only speak for Lafayette Parish, so we should get some updated guidance here in the next week or so. But as of right now, they're still closed. Yes, sir.
Will restaurants in Lafayette Parish be allowed to let customers sit outside to eat?
Great question. Yes. So the governor's going to update his orders effective Friday. So for our restaurants, not only can you continue to do curbside and takeout, if your restaurant has an area where you can sit outside to dine, under the new updated the governor's new updated emergency declaration effective Friday, you will be able to enjoy your meal outside. Now, service is not permitted under the governor's executive order, but at least you'll be able to sit down there and eat, and you won't have to be in such a rush. So that's good. That's comforting. Yes, sir.
you're in a position of leadership for the region, in a sense, the largest, the mayor of the largest municipality in the area. I mean, what role do you see that you need to play, sort of like over the next couple of weeks, trying to get? I know it's a multi-parish region; you don't have control over them, but in since symbolically, maybe, or in your relationships with them, what role do you feel like you need to play to actually kind of try to get Acadiana generally trending in the right direction?
You know, Christian, great question. I appreciate that. The greatest role that I can play right now is continue to be a team player. You know, look, we have Acadiana Planning Commission, our chairman, Larry Richard, president of Iberia Parish, Chester Cedars Parish president of St. Martin, serves as our vice chair. Honored to serve on the board at APC. Let me tell you, our parish presidents in this region and the just voluminous amount of mayors here in our region that join these APC calls Monday and Thursday. Dr. Stefanski is usually on those calls. It's not only heartwarming, but it's encouraging to know that we can tackle as a region an enemy that we can't see. We keep saying that. Look, this is still a deadly virus. This is still a virus that can infect people, that can spread. That's why, you know, Christian, every time I get this opportunity, I want to remind our neighbors, the number one line of defense, it's not the government, it's me and you. Let's wash our hands, continue to wash your hands, continue to social distance. If you can't exercise proper social distancing, wear your mask. And I think I know my fellow parish presidents understand the urgency of that. So biggest role is team player.
One more question.
I know you said that we're stretching this out here. Are you optimistic in 2 weeks that things will move into phase 1 of reopening?
I am, Neil. I'm very optimistic that we'll get into phase 1 according to the federal guidelines. Again, first line defense starts with us. You know, we're in a way we're fortunate that we're able to talk about how we were able to flatten the curve. We're not on that lower end yet of that curve, but our statistics are very optimistic and gives me a lot of hope and joy. And it should give our neighbors out there a lot of optimism. So just keep doing what we're doing. Exercise common sense. Wash our hands, social distance, and we will get through this. Now we do have Dr. Stefanski. We have Ms. Lamont. So Jamie, I don't know if who you want to introduce first. Well, again, it's always my honor to announce Dr. Stefanski, and we're so blessed. Not only is she leader of our task force, but leader of Region 4 here in the state. And Ms. Lamont has some good news too to share with our community as well. So thank you for your time. Appreciate what you do, and God bless you.
So I know we're all rushing since the governor, I think, is going to be on in a few minutes. So I just want to take the opportunity again to thank Mayor President for his remarks. He really hit on a lot of the things that I wanted to discuss. Importance of social distancing. We know we still have work to do in Acadiana and other regions across the state. And just to reiterate, y'all probably remember a couple of weeks ago when the modeling data came out, it did show that we are lagging New Orleans, Home and Thibodeau region by a couple of weeks. And so I think that is what we're seeing here. That is the burden of virus was the highest in those communities. That's really where the outbreak started in this state. And then we are trailing behind. But I know the people of Acadiana are going to help us to get through this over the next couple of weeks and reach the governor's goal of getting to phase 1 by mid-May. I just want to mention one thing before I introduce or just talk about Ms. Lamont, is the mask. So I have my mask. I won't put it on because I need to clean my hands and all that. But I just want to remind people, because I don't see a lot of people out. You know, when I go to the grocery store once a week, I don't see a whole lot of people wearing masks. And so I just want to remind everyone, it's the best way that we have to prevent infection or spread in the community. If you do have to go out, maintain 6 feet of distance and wear a mask. It needs to cover your nose and your mouth. It's to protect everyone else from anything that might be spewed. So I can pull it up. My hands aren't clean, so I'm not going to touch my face. But it needs to cover your nose and your mouth, and it needs to be over your ears. And then once you put it on, resist the urge to fool with it. So when you're in the store, your hands are not clean. We don't recommend you wearing gloves because you can't use hand sanitizer over gloves. I'm just going to use hand sanitizer now in case I need to demonstrate. So resist the urge to touch your face. Resist the urge to fool with the mask. You're actually counter to what we're trying to do by wearing the mask in the first place. And then when you get in the car, before you take it off, use hand sanitizer, and then remove it by don't do this because we don't want to touch our face. Remove it with the ear loops, and then you try to keep the inside clean. You know, fold it when you get home, hang it up, put it in a bag in the car, and then hang it up when you get home. Those are just really some simple tips. We want people to know how to safely wear the mask and how to safely put it on and take it off. And it's not intuitive if you don't wear masks often, and they can be quite hot. Also, don't ride around in the car for long distances with the mask on. And now if you're in the car with someone else and there's some other level of concern there, of course, if it's not a household member. But if you're in the car by yourself, try not to, you know, some people may find it difficult and have a negative experience wearing a mask in the car. We don't want people to get overheated. So I just wanted to say that. Secondly, I want to acknowledge that we have over 100 deaths reported now in Acadiana. So acknowledge that each one of those deaths, those are families that are devastated. So we want everybody to know, as we had that moment of silence, that they're in our thoughts and prayers in Acadiana. And again, please do your part to try to help reduce the further spread. Lastly, I know testing is a big initiative. The governor announced yesterday that the White House has assured him that they will have, the states will have the supplies that we need to greatly ramp up testing in May. And I just wanted to point out a community partner, Ms. Dodie Lamont. So I've been in this job for 19 years, and Dodie's been in her clinic for as long as I've been here. She's been a great partner to us over this period of time. Dodie works with Southwest Louisiana Primary Care, and the clinic in Lafayette that Dodie operates is Northside Community Health Center. And so as a result of us now being able to get some testing supplies through the state, Dodie's going to start testing at their site here at 1800 Louisiana this Thursday from 10 to 12:30. And they're asking that people call to pre-register just so that they can get your information into the system so that the drive-through or walk-through operation will be more efficient. And so that number, and I know Jamie will post it, is 678-9000. And so we hope, Dodie also works with clinics in Evangeline Parish and St. Landry Parish. So we're working to establish a routine testing schedule for all of those parishes through the great work of their clinics. So just want to acknowledge that we are working to increase testing throughout this region. But we'll start here in another mobile clinic this Thursday. I think we have just maybe a couple minutes. Do y'all have any questions for me?
Do we do any antibody testing in Lafayette Parish?
So there is no, there is a rapid, these point-of-care antibody testing that are now starting to show up on the market. There are some clinics around this region that are using that test.